Hi, everybody. So we are back. We are back for a virtual program, and we are here today with a very special person, which I'll tell you about in a few minutes. We have our studio set up really, really awesome. I wish everybody out there could actually see the amount of cameras, the amount of lights, and the teleprompters here and there. And of course, I got my laptop in case I want to look this way or look that way. And of course, I have my guest over here, and I guess you are seeing her as well. So I am going to get started. All right. Good evening again. This is Stuart Schlossman. I am Stuart Schlossman. Welcome to an MS Views and News event. And tonight's program, we are sponsored by Banner Life Sciences. And today we'll be asking questions to Katrina Bawden, a nurse practitioner, questions about a new MS treatment option that's out there. And I want to let you know more about Katrina first. So Katrina Bawden was born and raised in Utah and graduated with her bachelor's degree in nursing from the University of Utah in 2006. Katrina worked at Health South Rehabilitation Hospital until 2008 when she began working as an infusion and multiple sclerosis nurse at Rocky Mountain's MS Clinic. I bet you know a lot of the doctors I even know from out there at that time. All right, her love of caring for MS patients inspired her to pursue higher education, and Katrina graduated with a Master of Science in Nursing, Family Nurse Practitioner degree from Westminster College in 2015. Katrina has enjoyed her transition at Rocky Mountain MS Clinic from RN to nurse practitioner. Katrina is an active member of the International Organization of MS Nurses, which is also known as IOMSN, and is certified as an MS nurse. Today, Katrina will answer questions regarding the medication called Barfiertum. And Barfiertum was FDA approved in 2020 for relapsing multiple sclerosis. So I will be asking Katrina a series of questions. And Katrina, we gave her times that she should speak about these different medications, but she laughed at me and she said that she'll probably go longer than what I wanted, or she might go shorter, and that's okay as well. So I'm going to have this conversation with Katrina, and we're all going to learn, okay? I don't know what her answers are, and I don't think that she actually knows all of her answers right now either.
We'll find out together.
That's right, we will. So, can you first tell us a little bit about multiple sclerosis, just so we could get started?
Multiple sclerosis is an autoimmune disease, meaning the body's own immune system sees some part of the body as foreign and it attacks it. So different autoimmune diseases are rheumatoid arthritis, where the body's immune system attacks the joints, or multiple sclerosis, where the body's own immune system attacks the myelin, which is the protective coating of nerve cells or neurons, and it demyelinates it. And when it attacks it and demyelinates it, it causes lesions or scars. Multiple sclerosis, many scars, many lesions.
Thank you for that. So can you please tell us the different versions of or forms of multiple sclerosis?
Yeah, so there's clinically isolated syndrome, relapsing remitting multiple sclerosis, secondary progressive multiple sclerosis, active secondary progressive multiple sclerosis, and primary progressive multiple sclerosis. So clinically isolated syndrome is usually the first MS attack. One syndrome, clinically isolated, one attack. But it's enough to say this person is most likely going to have multiple sclerosis going forward. Then we have relapsing remitting MS. And I always say it's more like a roller coaster with symptoms that may get worse and then remit. Though it is a misnomer that some people think, oh, when I'm in remission, I no longer need to treat my MS. That's incorrect because it's an autoimmune disease. That means that underlying autoimmunity is always there. Also, sometimes people think when they're in remission, their symptoms go away. And that's also not true. Unfortunately, with each attack, damage can occur, and you may have permanent damage from that attack and permanent symptoms from that attack. Then we have secondary progressive MS, which tends to be people are in a relapsing remitting phase, and then they never fully come back from a relapse, and then they continue to accumulate more disability with time. And then we have primary progressive MS, where someone will pop up with an MS symptom and then get another MS symptom and another MS symptom, and nothing ever goes into remission, and that's the primary progressive form of multiple sclerosis.
Tell me more about the active MS. Yep.
So I think about active in a handful of ways. So first off, people say, well, do I have an active lesion on my MRI? So MRI is what we do to look and see the scars or the lesions of multiple sclerosis. So an active MS may mean a few things. It may mean you have a gadolinium enhancing lesion on the MRI, which means your body's immune system is busy attacking that lesion, and so it lights up on the MRI. But even an inactive lesion can cause symptoms. But then active forms of MS we think of as more inflammatory, meaning the immune system is busy attacking the myelin still, so it's more active.
Great, great. You mentioned about gadolinium, and I know that we didn't plan on this, but I want you to let people know what's going on out there with why they should or should not get gadolinium when they're having an MRI.
Sure. So gadolinium is essentially a metal that should not cross the blood-brain barrier. So when it's put in the bloodstream, it just hangs out there until you expel it. When you have an active MS lesion or you're under active attack, your blood-brain barrier opens up and it calls immune cells up through that blood-brain barrier. Now, as it calls immune cells up through that blood-brain barrier, the gadolinium is the right size where it grabs on and it follows the immune cells. And so we can see on an MRI that that is an active lesion, and we are concerned that the MS needs to be treated more aggressively or in a different way at that time. So there's a thought that the gadolinium may cause harm. We haven't found long-term evidence that the gadolinium can cause harm, but if you're concerned about it, we can always do an MRI without gadolinium to start. And if something is new or looks concerning, then we can repeat it with gadolinium if that's an item of concern for you. My patients that have been stable for a long time, we can just go ahead and do the MRI without gadolinium. But if I see anything new or different, then I would like to repeat it with gadolinium. But as of right now, there is no long-term evidence that it will cause a problem.
Okay, thank you for that. So when you're looking at the MRIs and you're knowing that a person is actually progressing, can you tell us a little bit more on the disease progression and what is seen for the MRI and how do you use that as a biomarker going forward?
Sure. So progression can happen in one of a few ways. One is radiographic progression, meaning more lesions. And another type of progression is symptom progression, meaning they have more symptoms or more disability than they did before. So unfortunately, at the beginning of the disease, new lesions can occur about 5 to 10 times more frequently than symptoms. So we use that MRI to monitor what's going on with the MS because they may not feel a lesion, they may not have symptoms of a lesion. And so we use the MRI to help guide us on, is this disease-modifying therapy that they're on working? Or if they're not on a disease-modifying therapy, do they need to be on one? And we can use that as another indicator of what their MS is doing.
Sure. Okay, that's good to know. So what can you tell us about the different classifications of medications?
So the medications, we have injectables, which are shots. We have orals or pills, and then we also have infusions. Now remember, like I said at the beginning, multiple sclerosis is an autoimmune disease, an immune system problem. So these medications aren't remyelinating. These medications aren't growing new nerves. These medications are treating the immune system in one way or another to tell it to stop attacking the myelin. And so with the different medications, they all have a different effect on the immune system in one way or another.
Okay. What can you tell us about the new medication, Barfiertum?
Yeah, thank you, by the way, to Banner Life Sciences for having me here. And also thank you to MS Views and News for having me so we can talk about this medicine.
Well, we love having you here.
Oh, thank you. So Barfiertum is in the class of fumarate medications. So fumarates are in the oral class of medicine, and we have a few now. So the first one that came on the market is Tecfidera, or dimethyl fumarate. The second one that came out was Vumerity, or diroximel fumarate. And then around the same time, we had Barfiertum, or monomethyl fumarate. Additionally, we have now generic dimethyl fumarate. So let's talk about what those look like. So I'm going to use my hands. So over here, we have Tecfidera, which is dimethyl fumarate, goes through an esterase conversion. The active metabolite is monomethyl fumarate. Over here, we have diroximel fumarate, which is Vumerity, goes through an esterase conversion. The active metabolite is monomethyl fumarate. Now, Barfiertum is the actual monomethyl fumarate. So it's the direct molecule. It doesn't have to go through any conversion to get to that point. Now, both diroximel fumarate and monomethyl fumarate were approved through the FDA through a 503B pathway, showing that they had bioequivalence to monomethyl fumarate, the exact same active metabolite that dimethyl fumarate was FDA approved under. Now, Tecfidera or dimethyl fumarate, there are now generic forms of dimethyl fumarate available as well as the branded Tecfidera.
Okay, thank you for that. So, people want to know, in what forms of MS is this being used?
Sure, so this is FDA approved for clinically isolated syndrome, relapsing remitting MS, and active secondary progressive MS.
Gotcha, thank you for that. And how is this different from other medications?
So, how it's different from other fumarates is the bioavailability and then not needing to go through an esterase conversion to be the direct molecule. I think it's important to remember when medications go generic, there is a difference in bioavailability. So in order to get FDA approved as a generic, they can have a 10% less effective or less potent or a 10% more potent molecule, and that's okay by the FDA. So if you're getting a generic Advil, let's say ibuprofen, you might get an ibuprofen that's 10% more potent or 10% less potent. And for a lot of medicines, that's totally fine. For some antibiotics, completely fine. With a fumarate, that can get a little bit tricky because people may have more or less side effects based on if it's 10% more effective or 10% less effective. And when you're on a generic medication, you might get a different generic manufacturer each month as well. So one month you may get one that's 10% more effective, one month you might get one that's 10% less effective. And so generic for some people is great, but generic for other people can really be difficult because they really can have side effects based on that.
Sure, thank you for that. So is Barfiertum, if Barfiertum is so similar to other medications of fumarates, why is it used then?
Sure, so a few reasons. The first is it's a branded medicine, which means we know that the person that is taking it into their body is getting the exact same medicine with every pill that they take. That's really important to me because I know that they're getting the same dose, the same concentration every single time. One thing that makes it different as well is there are no dietary restrictions. Some of these medicines are better taken with food or without food, or with or without alcohol or different caloric intakes. There is no dietary restriction associated with it, so that's why some people like it. And then also, this is a patient program, insurance is really important and coverage. So if it's covered well and people can get copay assistance, that's a really big thing. And with generics, although they're supposed to be more affordable, oftentimes they're not. And so you might go on a generic thinking, oh my gosh, it's a generic, so I'm gonna have my 20% copay, so it's gonna be $10 per month. And that 20% copay ends up being $500. And you can't get copay assistance for a generic versus a branded medicine we can get copay assistance for, which makes a huge difference.
That's great, thank you for that. How is Barfiertum used and how often per day?
Yeah, so it's a pill, and it is 2 pills twice a day. But it doesn't have to be exactly 12 hours apart. So when I say twice a day, morning and night.
What type of patients can benefit from using this medication?
Any patient with a relapsing form or active form of multiple sclerosis can benefit from this medicine.
Okay, thank you. And is Barfiertum a good choice for women who want to get pregnant?
Barfiertum is actually a really great choice for women who want to get pregnant. So back to it's 2 pills twice a day. The reason it's dosed twice a day is it has a very short half-life. So that means it's in quick and it's out quick. So if you're a woman wanting to get pregnant, it's in quick, out quick, so you can stop it as soon as you find out you're pregnant and you don't have to worry about a fetus being exposed to it.
That's very good. What about for people who travel a lot?
Great. It's great for people who travel because you can throw it in your backpack, you can throw it in your briefcase, and you can take it with you. And it can be taken with or without food. And so it's nice if you're on an airplane, oh, I got to take my pill, and you can just take your 2 pills and not have to worry if you've had food, if you've had breakfast, what you've had to eat or drink. Very easy on the go. Now, didn't used to be as important in the past few years as it is now. People are hopping on planes again and in campers again, going camping and doing all of the things that they did before this pandemic. And so it's very nice not to be tied to a refrigerator. It doesn't need to be refrigerated. You don't have to be tied to a clinic. You can take it around the world with you, essentially.
Thank you. So this we have a thing where medications, some people are too young to take them, some are too old to take them.
Sure.
Are there any age restrictions?
So I believe it's FDA approved starting at age 18. So I don't know if I wouldn't use it in children, FDA approved at age 18, but there isn't an age cutoff. We can use it as long as we feel that the benefit of the medication outweighs any possible risks associated with the medicine.
Okay, good. Thank you for that. And what about people that are health conscious, or even going forward, what about people with comorbidities that have, they're taking too many pills during the day?
Yeah. So a few things with that. So one really cool thing about the fumarates is they are essentially potent antioxidants. They work on the NRF2 pathway, and Barfiertum specifically, you breathe off the excess. So it's not filtered through the liver. There's no kidney restrictions. We don't have to make any medication dose adjustments based on any comorbidities. So it's really cool. Also, it does not interact with any other medications. So you can take it safely knowing that it is absorbed and metabolized a different pathway. It doesn't affect birth control. It doesn't affect cholesterol medications. And again, you breathe off the excess. So potent antioxidant that doesn't interact with anything else. So for a lot of folks that are health conscious and you get concerned about what you put in your body, this is a really good choice. It's as close to a natural treatment that we can get, because unfortunately we don't have any naturopathic treatments yet that have been proven to delay or slow the progression of MS. So if we're trying to go natural, monomethyl fumarate is a really good choice, being a potent antioxidant.
Good, thank you for that. You're answering questions a lot quicker than we were ready for,
Well, I like to do Q&A, so I want people to ask me questions.
That's good. So let me ask you, how easy is it for somebody to get Barfiertum?
Luckily, there's really good insurance coverage. So in my experience, I've not had trouble getting somebody on Barfiertum in the past year. There are those out there that may have tried to get on it right when it was FDA approved and may have had a little bit more trouble. So I would say to those people, give it another try. They have much better insurance coverage now, really great copay assistance. And Banner Life Sciences tries very hard to get medicine to people within 2 weeks, in my experience. So I have found it pretty easy to get people going in the past year. Great,
thank you. So we've been saying the name of the drug the whole time, Barfiertum, and other people say it other ways as well. I'll probably never get it right, but Banner Life Sciences is the name for people to know. That is the pharmaceutical company that is behind this product. And in your experience, does Banner Life Sciences offer a financial assistance program?
Yeah, so a couple things about that. Not only do they offer financial assistance, they offer free drug. So I view that as two different things, and it is two different things. So one is free medication. So let's say you don't have insurance, you're underinsured, you have a giant deductible, and you cannot afford a copay assisted with the medicine. They will give you medicine for free, which is amazing and can take a huge financial burden off. Also, they have copay assistance. So let's say you have a giant deductible, a $5,000 deductible that you need to pay before your medications are covered. They have ways to help get that covered and ways to help patients get their medicine. I always tell people with MS, your medicine should not be a financial burden. MS itself is a very expensive disease. There's MRIs, there's blood draws, there's all sorts of things associated with that. But the medicine should not be a financial burden. And it's even better, and I hope insurance companies are not listening to me tonight, it's even better when people can get copay assistance from a pharmaceutical company like Banner Life Sciences, and then that goes towards their out-of-pocket or deductible to help pay for the expenses associated with MS, like through routine MRIs, like through routine blood work that we want to do. I answered your question in multiple ways, but
did.
free drug as well as copay assistance. And my experience as a provider and my patients' experience, because I always ask my patients how it's going for them, has been very positive as well.
Great. So I'm out of questions except for one more. I'm going to ask, I can't be out of questions if I have one more, right? But I do have one more question. I'm just going to ask you from your own, without me having to encourage you or ask you anything, I just want you to add to this anything that you would like to, on your own, speak about Barfiertum.
Yeah, I feel like it's a really good choice for people who either are using a shot and they're tired of giving themselves shots, or they're scared to go on a medicine because they're scared of possible long-term side effects. Really good fit there. I feel like, in my experience, it's been more effective than many of the shots, and it's very safe. And what's nice is it was approved through the 503B pathway, and so we have it to compare to a medicine that's been on the market for a long time, and there's been no surprises. So it's always comforting to go on an MS medicine when there are no surprises associated with it. I'm not worried about increased risk of cancer. I'm not worried about funky, weird infections. The risks associated with it are what we know, and we talk about it, but it's a good, happy, safe place to be, and a really good oral choice.
Okay, thank you for that. And I want to thank you very much for coming out here, for doing this with us. Your words, your wisdom today, I'm sure have helped to answer many questions that people have. Okay, and I'm glad we're able to bring that.
Let me elaborate a little bit on active lesions. So back to multiple sclerosis, many scars, many lesions. When you have multiple sclerosis, it affects your central nervous system. So the central nervous system is comprised of your brain, your cervical spinal cord, and your thoracic spinal cord. People always say to me, well, why don't we do an MRI of my lumbar spine? Multiple sclerosis doesn't go down into the lumbar spine. That's just a bundle of nerves protected by bones. And when we talk about feeling lesions, what a symptom may feel like, I heard it once explained, think about your brain as a 6-lane highway. You might get lesions in your brain, but if you're a lesion and you're on the far left-hand lane of the 6-lane highway, but you're in the right-hand lane, you may drive past that lesion and never feel it or never have a symptom of it. So it might be easy to ignore and be in denial of that lesion. The spinal cord is much smaller. You have much less margin for error. So if you are on a 2-lane highway, let's say, and there's an accident or a big problem in a 2-lane highway, you're going to have symptoms of that lesion. You're going to feel that lesion. You're going to feel that it's going to get backed up for miles, and you're going to get caught in a traffic jam. So oftentimes people come to me and they say, well, I feel fine. I don't feel anything right now. And I'll show them what their MRI looks like. And I say, even if you're on the 6-lane highway right now and you're not having symptoms of those lesions, I really want to get you on a medicine to prevent more of those from occurring, because our body's ability to work around those lesions goes down with time, the length of time that we have MS, as well as age. So it's one of the hardest things being a prescriber and treating folks with multiple sclerosis, when I have to say, I'm sorry, I can't undo the damage that has been done. My goal is to prevent the damage from occurring, and the only way we have to do that right now is with disease-modifying therapies.
Absolutely. So before I get to the questions, and since you brought up about aging, let's talk about aging with MS.
Yeah.
Right? I was just interviewed the other day they wanted the male perspective on aging, and not just the male perspective, but that I'm 63 and aging with MS and what comes out there. What do you tell patients when it could be age-related versus MS-related?
Sure. So there is not a one-size-fits-all. When you have MS, people tend to blame MS for everything. I tend to say, let's make sure it's not anything other than MS first, especially with age. So if you're having pain, is there something else going on? If you're having hot flashes, okay, is it hormonal? Is it blood sugar? Do we have something going on with diabetes? Is there something going on with your thyroid? If you're tired, are you snoring? Do you have sleep apnea? And unfortunately, as we age with multiple sclerosis, we are also humans. And so somebody once said it's a birth certificate problem. The further away you get from your birth certificate, the more comorbidities or more things you may have. So then I always say, is it the chicken or is it the egg? So let's make sure we're treating the right thing with aging. Is it MS or is it something else causing your problem? And I think it's important to speak up with your providers to say, is this MS or is this something else? And can I do something about it? And not just be like, oh, well, it must be MS that my leg is hurting so bad. You might have a blood clot. There might be something else going on. And it's important that we monitor those things. And it's important to treat high cholesterol. It's important to treat high blood pressure. I don't want you to have a heart attack or a stroke and affect your brain even more than the multiple sclerosis is doing.
Absolutely. Thank you for that. I was going to ask you, since you're in the medical field, I want to know which came first, the chicken or the egg?
I still don't know.
Okay, I didn't think so. All right, next. Person named Renee writes, I'm 75 years old and am I too old to take this? I think you answered that. She also wrote that she's currently on okravis, but for the sake of her and anybody else that missed when you first spoke about it, please do.
So I'm going to answer the question, are you too old? So there is a concept called immune senescence. And the thought behind that is that the body's own immune system and autoimmunity calms down with time. So the great question out there in the great unknown that we're studying is, do you still need MS medication after a certain age? Now, I'm going to say that not everybody is the same. Everybody is different. And there are many people whose immune systems continue to be autoimmune even in their 60s, 70s, and 80s. And it is still important for them to be on an MS medicine even in their 60s, 70s, and 80s. I don't believe that when you turn a certain age, a switch flips magically and your MS turns off. So I always weigh the risks and benefits of the medicine with the person. And do I think this is a drug that a 75-year-old could be on? Absolutely. Is it a very potent MS suppressing medicine? It is not. So actually might be a good fit for a 70-something-year-old that we still need to treat the MS, but we don't want to suppress the immune system too much. We don't want to increase the risk of opportunistic infections. Can be a really good fit. I believe that every patient is different. And of course, that's based on your blood work, your MRIs, your physical symptoms, something to talk to your provider about. But do I have 75-year-olds on fumarate medicines? Absolutely, I do.
Great, thank you for that. There's a doctor that does a lot of our talks, and he tells patients all the time that the only time that they should stop taking their medication is when they die.
Right.
Right.
Yeah.
And that's it. All right, next. So next person says, well, how will it do with MS? But that's what this whole thing has been about. And that she have had MS for 34 years and is now primary progressive.
So if you've had MS for 35 years and now primary progressive, I would say we're more in a secondary progressive phase. Back to the beginning, primary progressive starts as primary progressive, hence the name primary progressive. But this is FDA approved for secondary progressive and still could be an option.
Right. Okay, thank you. Debbie writes, why would one switch from Tecfidera to this medication?
Sure. Really, really great question. So I am a big proponent of, if it's not broken, don't fix it. So how would we know if Tecfidera is broken? It may be broken if you are no longer getting financial assistance for it, or if you cannot afford it, or if you're having side effects to it. So to remain fair and balanced, if all of those things are not broken, then you should stay on your medicine. But if you're having trouble affording it, if you're having trouble tolerating it, this would be an option. So back to the esterase conversion and the direct molecule, it does look like it is more tolerable than dimethyl fumarate, meaning less GI side effects. So if you really like Tecfidera, but you're having GI side effects, it would be worth giving it a try to see if you would have less GI side effects.
Okay, thank you for that. And that leads to the next question, because Laura just wrote, are there any side effects?
Yeah, so the most common side effects, although low, are some stomach upset and then flushing. So flushing may look like a hot flash. It could be flushed face and neck, might be a little bit of sweating. but it usually comes on quick and goes quick. If you are a person that flushes, foods with pectin in it may help, applesauce, jams, jellies, and then Luden's has a lozenge that is supposed to be a cough drop, but it's not really a cough drop. It's the cough drop that your mom gave you when you said you were sick, but you weren't really sick, but she gave you something because you needed something. If you flip it over and look on the main ingredient, it's pectin. So I've had some people say that they flush when they're nervous or going into a meeting. And if they suck on a Luden's pectin's lozenge, that can really help. Very few people have had to discontinue because of the side effects. So there are side effects, but they are mostly tolerable. Some GI upset and some flushing.
Okay, thank you for that. Mary writes, does it make someone more susceptible to other illnesses or viruses or whatnot?
So on the label, there is a possible risk of PML, progressive multifocal leukoencephalopathy, which is on many of the labels for the medicines to treat MS. But in general, it's not one that we're very concerned about other infections. And then what's cool about it is we can watch your blood work and look at an absolute lymphocyte count. Now, I say that there hasn't been a correlation with opportunistic infections with the absolute lymphocyte count. But in theory, if your absolute lymphocyte count went lower, we might get a little bit worried about infections. But in general, no, I'm not too concerned about opportunistic infections.
Okay, are there any pre-lab tests that are needed?
Yeah, so it's actually really easy. We just do a complete blood count, and then we check your liver enzymes, and then you're good to go.
Okay, thank you for that. Next, the question is, I have MS and Crohn's. I take Stelara for my Crohn's disease. Will Barfiertum be good for me to take?
So that would be a question for both your GI and your neurologist. I cannot speak to that, but I can say it's not contraindicated in Crohn's, and it would not be contraindicated with Stelara unless there's something going on with your blood work from Stelara that would limit us from using a fumarate, but it can safely be used in Crohn's.
Thank you. How does this compare to okravis?
So that's comparing apples to pineapples to oranges and bananas. So it's a completely different class of medicine. Okravis is a B-cell depleting agent which kills cells. This medicine is a potent antioxidant. So it is in a different class of medicine.
Okay, thank you for that. All right, next one is from a person who wrote in yesterday, and he or she says, I'm interested in how this compares to Vumerity, specifically how the different method of absorption could affect the potency in different bodies. And is this med absorbed later in the digestive system? Does it lend it to be stronger or weaker? I cannot read it.
Sure. So diroximel fumarate is Vumerity, goes through an esterase conversion, and then the active metabolite is monomethyl fumarate. So per Vumerity's label, it is recommended that you take it with a 700 calorie meal or less, as the absorption may be affected, the Cmax and Tmax may be affected, versus the Barfiertum, the monomethyl fumarate is just going, it's that direct molecule. There is no conversion. So their label does not have any dietary restrictions on it. So the absorption may be a little bit different.
Okay, gotcha. Thank you. A question asks, does it stop progression of the disease?
That is the goal, yes. When we're treating multiple sclerosis, the goal is to prevent new lesions from occurring, delay the progression of the disease, and prevent relapses from occurring. So yes, that is the goal with the medication.
Okay, and so most medications say that they work to slow disease progression.
Yes.
Okay, and so are you, though, saying that the goal is to stop the progression or to slow it?
So the goal is to slow progression, but my ultimate goal is to stop or halt progression as much as we can for as long as we can.
Okay, thank you for that. How long can this medication be used?
As of right now, there is no lifetime limit on it. Some medicines do have a lifetime maximum. There is not a lifetime maximum on this medicine. Now back to how it works and how it's in quick and out quick with a 12-hour half-life. if we were ever concerned and we needed to switch to another medicine, or if you ever decided you want to get pregnant or you want to switch to another medicine, that's easily done because it's in quick and out quick, and then no lifetime maximum on it.
Okay, thank you for that. A person asks, did Katrina say that Barfiertum is not hard on the liver or kidneys or other organs?
So it's not filtered through the kidneys, so there's no dose adjustment. We breathe off the excess through the lungs. We do monitor liver function, so it should not be hard on the liver.
Okay, thank you. And going back to it being compared to other medications, if you had a choice between the pills or the injectables or infusions, did I say that already? I don't even remember.
You said you're good. Injectables and infusions, yeah.
Yeah,
Good.
there you go. So, what would you prefer that a person do?
Every person with multiple sclerosis is different. Dr. Alan Bowling once said, I'm an equal opportunity prescriber, and I am also an equal opportunity prescriber. What I do is I look at the person's goals, their lifetime goals, their career goals, their family planning goals, their treatment goals, and also I look at what their symptoms are. And then I also look at what their MRI looks like. And then we have a discussion. My job is to be an educator, and my job is to be a navigator and a coach. And then we decide together what is best for them.
That's excellent.
There are some people that are better fit for injectables, and there are some people that are better fit for orals, and there are some people that are better fit for infusibles. And we make that decision based on every patient, different situation.
Okay, thank you for that. And there's not much more to do with today's program other than
it's just so easy.
It was like incredible. We're like done, and I've got to look for my video producer and say that we're done with the program because he's got to turn it off. And I don't know where he is, but he's running back now because he's going to have to say goodnight to everybody.
The safety was. It's just so easy. It's just such an easy medicine. It doesn't.
I heard it's different
easy.
Colors. Is there any color combination to this? I don't know.
No.
Okay.
Yeah. No.
Okay, so is it? Are
They're
they little
gel
pills?
capsules.
Okay,
Mm-hmm.
That's what I heard.
Yep. Little
Okay.
gel capsules,
That's
and
great.
you take 2 twice a day. They're not too big.
They fit like in a little pill case and stick them in your pocket?
Yeah. They
Oh,
look
that's
like
very
little
easy.
football, little football thingies.
That's great.
Yeah, they're
That's
gel,
great.
and I'm told they slide down easy. So not hard at all.
Good.
Shouldn't be broken, shouldn't be squeezed out, anything like that. You just take them home.
Okay.
And the reason they did 2 pills was to make it more manageable, so it's smaller.
Okay. Oh, that leads to another question. So what happens if you forget to take the second one?
So if you're still within the same day, go ahead and take the second dose. But if you wake up in the middle of the night and you need to take your morning dose in 3 hours, just skip it and take it the next day.
Okay, great.
And then always, a medicine on the shelf 100% of the time will not work. So if you find that you're having trouble taking your pills, let's figure out a way so you don't forget to take it. So is it a pill box? Is it having it by your toothbrush? So you take it in the morning when you brush your teeth, and you take it at night when you brush your teeth, and you better be brushing your teeth twice a day or we're going to be having another conversation.
That's right.
Or is it that you have it at your table with breakfast and with dinner? So we can always find a way to remember. Is it reminders in your phone? Is it having some in your car and some in your office so that you don't forget to take it? Because it is important that you take it twice a day.
That's right. I am saying goodnight to everybody right now. Thank you for being with us. And again, thank you to Banner Life Sciences and Katrina for coming in all the way from Salt Lake City. Have a great night, everybody. Bye-bye.